Dr. Laura. How are you?
I'm well, Swamini. How are you?
I'm also good. Thank you. Thank you for joining this call today. And I'm really interested in the way your career has transitioned. And I really want to discuss all of those things and including what all clinical and non-clinical options are out there for other dentists. So let's just get started. Can you please tell me a little bit about your professional background?
Yes. So I wanted to be an orthodontist actually when I was a kid because I had a really good experience with getting my braces off. I was really excited about that. I wouldn't say I had a great experience with braces because who says that, right? I don't know if you've ever had that, but they're not like the most fun thing in the world, but the result is what matters. So I remember being really excited about that and wanting to help other people smile. So I ended up going to dental school and realizing that I wanted to pursue general dentistry. And I liked dental school. It was fun. I enjoy being in school. You know, a lot of us enjoy the learning aspect and just showing up every day and learning more. But then when I got into the real world in about year 3 of private practice, I became very burnt out. And I was looking for a way out of dentistry, but I was not really sure about that choice. So I ended up staying in for another 7 years. So I practiced dentistry for 10 years. And then at the end of those 10 years, I ended up basically quitting.
I want to know like what inspired you to become a dental career coach rather than like anything else. I think from that point you could have gone anywhere, but why career coaching?
Yes. Okay. So that's a great question. So getting into dentistry, dedicating your whole life to getting here, investing everything, investing your time, your money, your identity, doing all of that, really, you feel like you don't have any other skills. And you feel like, who would you be if you stopped being a dentist? So it keeps us really stuck. And that's what happened to me. So I ended up not knowing what to do. And a few years before I quit dentistry, I worked with a career coach because I was miserable. I was depressed. I was anxious. I was burnt out. And the work I did with a career coach was very helpful. And I really liked it. And then I also had to get therapy. Like I was doing everything. I did a lot of personal development. And so eventually I started seeing that I have other skills and that I could do other things. So I started blogging, and that opened up my awareness to the world because I had to write stories. So I was just blogging about food and travel. And every time I'd go on a trip, because I was writing these little mini stories about my experiences, I just started to pay attention. And that opened my eyes to what else was out there. And I ended up becoming a weight loss coach.
Okay,
So
wow.
I was able to build this weight loss coaching business under the umbrella of my husband's business, which actually made it so much easier. And I always encourage people to take the easy path because it's a hard path.
Yeah.
So who cares if you have to get a partner or have someone help you? We don't need to be so stubborn about this, right? Because once you change, then you'll never be afraid of changing again. So I was able to use my husband's office manager to schedule my clients, and I was able to get a room in his office and do this weight loss coaching business. And that was ultimately what pulled me out of dentistry. Eventually, after doing that part-time and dentistry part-time, then I was able to walk away. And so I left dentistry. And when I left, I was blogging about food and travel, and no one read my blog. And then one day I saw this blog post titled 10 Reasons I Hate the Dentist. And I was like, well, that's not very nice. Here's 10 reasons your dentist probably hates you too. And overnight, that post went viral. So I had about 300,000 hits to it in 3 days. So suddenly I started hearing from people all over the world. I mean, I specifically remember hearing from a dentist in Egypt who said, yeah, you know, we have the same thing over here too. Our patients, except instead of telling us that they helped us buy our new car, they tell us that they helped us buy the shirt we're wearing. And so it was amazing to see how universal dentistry is for dentists all over the world. You know, we all have such cultural differences, but we all have so many similarities too. So that was pretty fascinating. Connecting with all these dentists allowed me to see that I wasn't the only one. Like there are actually other people who weren't enjoying their careers. And so I always had this dream of creating this coaching business where I could help other dentists create whatever they want in life and learn learn that they could career change if they want, or that they could design dentistry so that it fits them. Now, I don't know what it's like in India, but here in the US, you can work 2 days a week and make a decent income. And so that gives us the chance to explore other things. And I know that's the same in the UK as well, and probably Australia and Canada, but I don't know what it's like in any of the other countries beyond those four. So it's actually an opportunity that we can explore. So anyway, I just for years blogged about it, but never felt like I could start my coaching business yet because I still felt like an imposter. I was judging myself and I thought, well, that's great if you can quit something.
Yeah.
And I just quit something. So how can I help people start something if I've never started something? So I needed that time. I spent about 6 years doing other things, doing the weight loss coaching and other things to really see that I could build something else. And so then I could guide others to build something as well. And then that was when everything fell into place, that I just gave up all that other stuff. I still do the weight loss coaching. It's still a side gig. It never quite turned into a full gig, but it has led me here. And it's a good thing because sometimes when things don't work out and we want them to, we think that that's the worst thing that could happen to us. But sometimes it's the best thing that could happen to us. Like if something doesn't work out, it's opening a door for something else. And so it opened the door for me to really say, okay, I'm going to step into this career coaching now. And because I've experienced it myself, because I've experienced the pain of feeling stuck and not liking what you do and investing everything to get into a career, I'm really passionate about helping others not stay stuck as well. So that's how I got here.
How long ago was it when you made the switch?
So I practiced for 10 years and I left. I made the switch 10 years ago. So I've been out as long as I was in.
Wow. So which part was the best for you?
Oh gosh, the current one. It's a good question, though. I love it. Yeah, there is life after dentistry, and it's great if people love it, right? I wish I loved dentistry. My life would have been easier, but it's actually been much more of an adventure because it's forced me to explore myself and the world in ways that I never would have if it were comfortable and easy. And it is that for some people, and it provides a great life for some people. But if it doesn't, it's important to know that we don't have to stay stuck.
Yeah. So when you talk to prospects or your potential clients or just like dentists in general in your network, so what kind of traits do you see that make you feel that maybe they need to switch careers?
So this is what's actually really interesting is there are some specific traits or signs of burnout, and they are, for one, it's your energy, like feeling like you have no energy to do other things. You might get sick a lot. You might have irritability or lack of patience. And the really big signs of it for me when I was burned out are that you can't celebrate your accomplishments. And I very much remember really doing some impactful dentistry on people. And I was so focused on what could go wrong or what was not right already that I couldn't even celebrate how this work that I did completely changed someone's life. And so I think it's almost like a hopelessness, but that lack of seeing and celebrating your accomplishments is a huge sign of burnout. Another one is, and this one was huge for me too, is losing compassion for your patients, losing empathy. They call that compassion fatigue. And it's where instead of understanding and feeling connected to my patients, I just saw them as gigantic burdens. Like their problems became annoying to me. And I just couldn't have that empathy anymore for them. And so it almost ends up, you sort of demonize each other in a way. And I know a lot of dentists have felt demonized by patients, but when you're burnt out, you demonize the patients right back. So it's a really hard when you got into this field to help people. And then you find yourself thinking, I don't want to help people. So those are the signs of burnout, some of the main signs of burnout. And when I look back on my career, those were all the things that I had, all the classic signs of burnout. So I have this new thing I'm always wondering about is like, what is the difference between feeling burnt out and actually disliking what you do for a living? Because I thought I hated dentistry. And if you ask me now, did I make the right decision? Absolutely 100%. I've never missed a day in my life. I really don't miss anything about it because all the things I liked, I still get to do in my life. But where's that fine line? You know, now when I love my work, I can feel myself getting burnt out and it's different. So I don't know. I mean, that's kind of a weird, I could upend all of the theories on burnout and say, well, what if it's not actually burnout, but you don't really like what you do anymore. So that's why I would say, like, if you are constantly having anxiety, if you have depression, if you dread going to work every day, if you go on a vacation and before your vacation has started, you're already worrying about going back to work a week later, then those are all things they're signs that something's not right. And that's your body's way of telling you, pay attention. It's kind of your intuition. Intuition happens with our feelings, and that's your feelings telling you, this is not right for me.
Yeah. So what are the pro tips that you give to people who experience burnout?
Well, so I always talk about the low-hanging fruit. And so the low-hanging fruit of burnout. And again, this is another way of finding out, am I burnt out or do I actually not like my work? So when I feel burnt out doing the work I love now, and I do get to take a vacation, it helps. Yes, we all have those moments where it's like, I'd rather stay sitting on the beach than come home to 500 emails. I get that. That's normal. But if it doesn't help, if a vacation or a break doesn't help, then maybe it's something more. But if we look at like the everyday self-care, because in dentistry, we sacrifice ourselves so much to help others. And so if we look at, are you treating yourself the way you would treat your patients? So are you putting your health first? Are you getting enough sleep? Are you eating healthy food? Are you exercising? Maybe it's doing some mindfulness or meditation. Those are all the things that we neglect, thinking that we don't really need them. But every time I talk to someone who's burnt out, if they're not doing those things will give them that boost where they start to feel better. And then if that doesn't work, then we need to look more internally, like, how are you seeing the world around you when you're at work? And are you constantly trying to be a perfectionist? And are you a people pleaser? And when we feel like we need to be the hero to our patients, we end up carrying their problems as if they're our own. And that's what creates the burnout. So if we can begin to practice looking at things differently, like, I can be here as the health practitioner to support my patients, but I don't have to carry their burdens as if they're my own, then that can create a lot of freedom, because we create a lot of our own burnout because we want things to go so well for our patients. We put so much pressure on ourselves to do it that we then go home and worry all night. And then that keeps us awake so we don't sleep. So if we're constantly worrying, there are things we can do to practice shifting our thinking so that we give ourselves a break. Like, we don't need to be everything to everyone, and we can't be that. And then asking this, like, are my patients better off if I'm feeling good, or are they better off if I'm sacrificing everything for them?
Yeah. I think this advice goes for other careers also. So what are the clinical and non-clinical career options that you suggest mainly?
Yeah. So like clinical options, I've spoken to several dentists who never want to own a practice. They just want to be an associate. And they feel or have felt like the dental community at large judges that, where like, you're not as successful as a dentist. So I say, design your clinical career however you want. If you want to be in public health, or if you never want to own a practice, or you want to work 2 days a week, those are all of the main clinical. Obviously, there's teaching as well at a dental school or a hygiene or even assisting school. But non-clinical roles here in the US, teaching is another non-clinical option, as well as working for an insurance company. Those are kind of the basic ones that everyone knows about. But I have 2 friends. They happen to be twins, and they both went into dentistry, and they both got into non-clinical careers. And one of them is working as, there's a term in medicine called medical science liaison. And that's someone who, you're not in sales, but you're basically the connector between the company and the doctors. And we have that in dentistry too, but that term's not as common. So one of the twins, that's what she does for her non-clinical job, is she works for Procter & Gamble and helps create awareness and education to her dentist clients so that they know what they're getting and they know how they can help patients with their products. And her twin actually works with a practice brokerage firm. So she does marketing and business development. So completely nothing dental related on her end. It's just she does it for a dental company. And that's another option, becoming a practice broker or a consultant or a coach. And you could be a coach for someone outside of dentistry too. I became a weight loss coach and I worked with a couple dentists, but that's only because I knew them, not because it had anything to do with dentistry. So there are a lot of options, and people always ask me, what can I do? And I always think, you can do anything. Like, don't let our options keep you stuck, because if I give you a list of options, you might miss out the fact that you can do anything. There's actually dentists who quit dentistry to become a Cirque du Soleil clown. And here in the US, there's a dentist who is an NFL referee. NFL is our National Football League, and he left dentistry. So if you get yourself to be an NFL referee, you've gone pretty far in that career. And so it's like, it doesn't have to be this very, like, I have to go into a dental specific field. Although there are so many dental companies, software companies, supply companies that hire people. So why not a dentist?
Yeah. So I have one final question. What advice do you have for someone who is afraid to make a switch or who is hesitant to speak to a coach?
Well, one, I would say just reach out. A lot of coaches out there are happy to talk to you. I always offer consultations. And then if you want to work with a coach, you can. And if not, you don't have to. So part of it is like, just do it, right? Just do it. There's a reason that became the Nike slogan. It's because it works when you just do it. But beyond that, I would say, think about how you could start a side gig. Instead of looking for the perfect plan B, the perfect plan B is never going to come. You're going to wait and wait and wait until you find it. And you're never going to take a step forward because it's never going to happen. So if you can think about having fun with it, exploring, putting no pressure on yourself to find the perfect plan B, then you'll begin to open up your awareness. And you'll see that you can do other things and that maybe you like other things and there are opportunities, and it's not the end of the world if you don't stay practicing dentistry. And so I would say, get creative, tap into your creativity, your creative thinking mostly, and just explore and try starting a side gig or a hobby that can open your mind to new possibilities. And then just look around everywhere you go for new opportunities, and you'll start to see them with practice.
Thank you so much. This was very insightful. And I personally felt like my confidence has been built a little bit more.
That's great. Thanks so much, Swamini. It was great to be with you.
Thank you so much.
Okay,
bye.
Bye.